Welcome to the podcast of Data and Analytics in Business. We will learn from the leading industry experts using data and analytics to solve the problems and create values in practice. We will also learn where the industry is heading to and how data and analytics will shape the industry in the future. Most importantly, how they are preparing their business for digital transformation and disruption in the future. I'm your host, Jason Tan, and thank you for listening. In this episode, we have got Rachel Fojtik. Rachel is the business engagement lead for data and digital solution at Mater Health Services. She is also the managing director at Literate by Design. Rachel is currently responsible for business engagement in Mater Data and Digital Solution team, where the key focus is on the engagement of the business team in using data effectively to make decisions. Rachel and I start our discussion in how to increase the data literacy for any organization. Equally, what does it mean and what sort of impact it will make when the organization as a whole is more literate and understanding the use of the data in order to make the organization more data-driven. Further on that, Rachel shared with me a number of tips and strategy where the organization can adopt in order to increase and help the organization to become more data-driven. Equally, how to train the people within the organization in terms of the data literacy. Moving on, we talk a little bit about her works at the Mater Health Services. In this part of the conversation, Rachel shared with me some of the works that she is doing at Mater Health Services, as well as how to increase the data literacy and the engagement on the use of the data analytics within the healthcare industry. We also spend quite a bit of time in understanding the mindset of the use of the data and analytics within the healthcare industry versus the commercial sector. More than that, we also delve into the storytelling and its impact that one could have if there are more to be done in terms of the healthcare services. If you are the executive management team who is in the healthcare industry and you always want to understand how to increase the use of data and analytics and how to increase the data literacy within your organization, and equally, what are some of the challenges that you might face as you are wanting to adopt more data and digital solution within the healthcare organization of yours, I would highly suggest to listen to what Rachel has got to say and also sharing her experience in this episode. Equally, if you want to understand how to use the data to tell more about your organization and how to infuse data in your storytelling, especially in sharing many of the good things that you are already doing in your organization, how to take your branding and marketing to build a stronger brand within the community that you are already working so hard in serving. There are some really great gold nuggets in this episode from Rachel. I hope you will enjoy the episode. I am your host, Jason Tan. If you like more episodes like this, make sure you click the subscribe button in your podcast episode. If you really like what we have got and what we have been doing, make sure you spread the word to your colleagues or social media. I would really appreciate you doing that. I'm your host, Jason Tan, and I hope you enjoy the episode. Good morning, Rachel. Welcome to the Analytics Show podcast. We finally meet and have a chat about this. I'm super excited to have you this morning and welcome again.
Thank you. Nice to be here.
Before I start, and I suspect that you get this a lot, let's settle it one and for all in this podcast. And whoever listens to this podcast would have no excuse in asking this question. So my very first question for you is, how do I pronounce your last name?
So it is pronounced foy. So the J is a y sound in Europe, so foy. And then it's a soft, it normally has a little thing over the T, so it's a soft T, Fojtik.
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 Rachel
Fojtik.
I love it. That's a beautiful sound. It reminds me of the French that I tried to pick up, and also a bit of time that I spent in Europe during my summer exchange.
Yeah, this is my husband's surname. So he's from Slovakia. So that's how I get the last name.
Right. Fojtik. I think I got it pretty well now.
I think so. Yeah, that's pretty good.
Wonderful. Thank you for that. Now, moving on. So my research has shown me that I know you do quite a bit of volunteering, like, for example, mentor at the Cherry Blair Foundation for Women, where you are mentoring young entrepreneur women in developing countries, providing advice to assist them with business profitability. Share with us a bit about this volunteering side of your life and what are the ways that you are helping and how many countries that you are involved in where you are helping?
So, yeah, I'm not helping in a lot of countries. I am not still doing that particular foundation any longer. I'm not still a part of that. But it was a very good enterprise, if you like. So Cherie Blair, as some of you probably already know, is the wife of Tony Blair, who was the Prime Minister of the UK for quite some time. And she set up the foundation for mentoring, particularly people who are starting up small businesses or running businesses over in countries where perhaps it's a lot harder for them to get the help that they need or the support that they need. And so that's what that was about. And I rather enjoyed, I mentored a young lady actually who was running a business there. It was a manufacturing business. And just hearing some of the challenges that they had and being able to sort of speak to them. But I wouldn't say that I gave very much to her so much as I think she gave me a lot. So yeah, I think there's a lot to be gained out of mentoring others because I don't think I give as much as what I actually get back. So that's something I would say I very much enjoy volunteering for that reason.
Fascinating. How did you get into this volunteering in the first place? Why this wonder?
I've always wanted to give back. I get so much from others. I just would like to be able to give back, and that's why I do it. At the moment, I'm volunteering on the Nudgee School Advisory Council. I rather enjoy that too. I think it's I love the school. I think it's fabulous, and it's so nice to be able to give something back and see that we're helping the next generation. So yeah, that's the reason to volunteer. I enjoy it.
I love it. Yeah. Please shed a bit of light on your organization, Data Literate by Design, and your role as the managing director over there. So what is Data Literate by Design?
Yeah, so I guess I'll go back a little bit first and tell you why I've set it up. I think one of the key challenges that we have in becoming more data-driven and making more evidence-based decisions, one of the challenges that we have is actually the ability for people to use data effectively. Some it's just a lack of understanding. Some it's a fear of knowing how to do it, and for some it's just realizing that the sort of scope and breadth of the data, it kind of means that you can get different truths and different viewpoints. And I think that challenges a number of people. And I think this is my opinion of why I think that people don't use data effectively. And I just think that there's a real opportunity to make a difference there and to start to educate younger generations and our current generation and even some of the older generation to be able to dive into the data and get to know the data and then step back and just make the right decisions based on what they've seen from that evidence. And I think that's something that I would like to be able to help enable. And that's the reason I thought of setting up Data Literate by Design, was to start to help people become more capable with data, help organisations to set up strategies that will enable their workforce to become more data capable. That's in a nutshell. And so that's what I do there at Data Literate by Design.
When you say that you are training or helping some of those people, I presume, and I'm guessing that you were referring to the people who could be in any other role within the organization rather than the data professional, rather than the analytic professional, because the whole idea here is that
apart from all these, the analytic professional who is already reasonable familiar or familiar with the data and analytic, actually there are so much value we could create if we get the entire organization that include the frontline staff to be more data literate. Is that you were focusing?
Yeah, it's part of the focus. There's really two focuses, right? So the second focus is actually the data and analytics team becoming more business literate, if you like. I think there's a real challenge that we have when we're asked to deliver something as a data and analytics professional to understand what is really needed. And we all know that when someone says what the problem is, they even perhaps say what they think the solution should be, and it's not necessarily the thing that's going to solve the problem. And if a data professional just does what they're asked, then they may not see the fruit of the work that they've done, or the work that they've done and the time they've put in may not bear the fruit that the person who requested it initially expected, because the problem hasn't been deeply understood, and then the impacts of the solution haven't been deeply understood. So they haven't understood what changes are needed to make it happen. They haven't sort of stepped further back and gone, well, what are the processes that this is fitting within? Will it fit within the process? Will it add extra work? Will it not add extra work? Will it create an angst amongst the people because it's being shown and therefore not be used because of that, or be discredited? We see those sorts of things happen too. So I think it's really important that analytics people get to understand the business environment they're doing the work for too.
I so agree. I think sometimes the analytic or the data guys could be so focused on the technology and forget about the side of the world and what has to be achieved in that side of the world. I so agree with that. I think it would be good if everyone have a better understanding and able to see the bigger picture. How do you think the training is required to help people to be able to step back and see a bigger picture rather than super focus on the tasks that they have got in their hand?
That's a really, really good question. And I think, so a part of the training that I offer actually is the part of how do I tell a good story with the data. And within that course, I also have a piece there that looks at the problem definition. In fact, I do the same with the dashboard training. So it looks at the problem definition and getting there and understanding the problem first and giving them frameworks for understanding the problem. I think that's one of the ways that the trainings do help. Yeah, just getting back and solving the problem as opposed to just doing what's being asked, I think is one of the things. So the second part is just the actual, how do you use data? What is data? And I think even a lot of people just don't even understand the connectivity and the flow and the fact that an action results in a record, and that then, I mean, most do generally, but that an action results in a record, and then that the record has, certain features, and that you can then group the records and you can see this particular trend, and that you can analyze it on this chart and see these sort of actions and start to make decisions based on the ebbs and flows. I think helping them sort of do that connection between the action, the collection of actions, and the visual of that and how to interpret it, and then perhaps make decisions on the back of that is very valuable and powerful. And I'm finding that even having to take them right back to the very basics and some of the things that us data analytics people would consider basic, the flow into like even what is a SQL Server database, for example, or a server, and then even what are the different functions and processes that people have to do to use that data.
I so agree with that. I think the flow of the data from the business system into the data warehouse, I think sometimes it seems like that part is very much ignored and not enough focus is being paid over that. But the reality is whatever the data that you are using is important to understand how it got created in the first place. So,
well, especially if you're saying, I would like to update that data on a minute-by-minute basis, for example, what are the implications of updating it on a minute-by-minute basis? Is it actually even feasible based on the activity that happened? Is it feasible based on the way that the server from the tool that they're using replicates at night, or, whatever the processes are? How do we actually take that data into the data lake? Is it feasible to have up-to-the-minute updates on your dashboard, for example?
Exactly. I think I just triggered Sri to speak. So if anyone was hearing, there was a third voice speaking. That was Sri from Apple My Watch. Now, I want to ask you about the talk and the discussion of the importance of the data and analytics. It has been on the rise for quite a number of the years now. Like we literally have this thing called data is the new oil. I sometimes
I've even said that a few times too. Whoops.
But in your experience about working with the business, do you feel like businesses are fully aware of the importance and making enough efforts to make their organization more data-driven?
I think not. I think, and if I think about healthcare as a really good example of this, I don't think so. Because the opportunities that you've got with healthcare, the opportunities to save lives is huge. Imagine we could start to take some of the data that we receive, and start to analyze, cause and effect in larger groups and more collaboratively, if we could actually start to see, and I'll just take an example of heart patients, right? And the particular medications that you give heart patients, and analysing the different types of heart patients and whether or not they all need the same medication, or what are the impacts with changing and altering that medication, and cohorting them into groups that have certain reactions. And there's such an opportunity there to start to use a far more refined approach to the medicine that you give, by understanding far more about each individual patient that you have. And if you can start to analyse groups of patients with similar symptoms, behaviours, reactions, you may get a far more prescriptive approach to medicine. That's just a really silly example, but it's the same if you go into banking and finance. I mean, even in banking and finance, I think they use data far more heavily and far more effectively. I think you would find a good majority of their staff are data-driven. But there's still so many opportunities there that data provides as well. And I think sometimes that we underestimate or don't consider the future. And I'll give you a silly example. Let's just talk about, and this is extremely non-data oriented example, let's say crutches. So crutches were created because people just got sick of using sticks and they felt that they could make crutches stronger. But have you seen the crutches that have been developed far more recently, that if you've got a broken ankle, you can actually just strap to your knee, and now it works as the leg as such, and you move your legs, you don't need to use crutches for it. It's an example of, I don't know, maybe I should show you it visually. It's an example of a design that could have been thought of all of those years back when the crutches were made. But because people were replicating the existing stick function, they didn't think about, well, how could we actually improve on that? What are the opportunities with that? And so what I'm trying to say here is that I think we do that with data too. We forget to think about the actual opportunities, the future opportunities that we could do with what we have now, as opposed to just, well, what were we doing before? Let's try and now automate what we were doing before. You hear what I'm saying? And I think that's I think one of the challenges that I think we could, or one of the ways that I think we could more effectively start to use data. And I don't think companies do that well.
I do want to move towards about the healthcare services, which is some of the works that you are really focusing now. And I'm going to jump ahead about this question. One of the things that sometimes I feel like perhaps the reluctance or the resistance of adopting more data analytics, or maybe I should say they are doing way more carefully with much of the resistance in terms of adopting the analytic in the healthcare. It could potentially because of this direct impact on the patient and their life. So I suppose perhaps this is the challenge that they are facing to get the stakeholder on board in implementing more of these emerging technology like analytic and AI. Having worked in that area for quite some time now, do you think that is the case as opposed to people in the finance using the data and analytics?
So I would say yes and no. Look, I think healthcare professionals are quite adept at using data for research purposes and for getting in and really understanding how to perhaps improve their environment. And that's a definite goal that they have, and a passion that they have is to get better outcomes and to do better by their patients. That's definitely a drive that they have. In terms of the time that they have to actually do that, that's a challenge I think that many of them face. And there's a number of people I talk with who are clinicians, and you hear them talking about the fact that they're doing it at midnight because that's the only time and space that they've got, and amongst their sometimes very, very busy schedules. And I know of one ICU doctor that I've been speaking to quite regularly, who he goes to 6 different hospitals and works in the ICUs of 6 different hospitals. He then goes home and innovates, and he has children. He's busy. And I think that this is one of the challenges that our clinical workforce has, which makes it a little bit harder for that sort of level of uptake of data. The other challenge that healthcare has is that it's an extremely broad subject area, extremely broad. And for us, even in the data and analytics environment, to capture everything that is needed for them to be able to do what they need is a challenge. So they come to me and they say, Rachel, I would like to, and here's a silly one, I would like to include the BMI in my analysis because it will make a big difference to my understanding of the impact of this anesthesia. Let's just give an example. And I'll turn around and I go, I'm sorry, but the BMI is only captured in the paper notes. Well, great. I can't do anything then. This does not help my solution, So this is a challenge that we have in healthcare. Yeah, we're slowly working towards changing that, but the breadth of the tool sets that are used as well, how do we actually make sure that all of those tools are aligned? How do we just get one patient record? In actual fact, that's a challenge healthcare has. And because of its absolute diversity of, what's the word I'm after? Hang on. Practices anyway, we'll just call it that. That wasn't quite what I wanted to say, but the diversity of practices there, that means that there is also a diversity of systems. And each system has a totally different need. That means that we've got to find ways to capture all of those different systems and align them and make it possible for us to understand one particular patient and the nutrition that they were given, the food that they were given, their nutrition, their potential for, I don't know, anaphylaxis, let's say, or any number of things. If you want to have a look at one patient, you need to get all that data from all of the different systems to really give you a good round picture of that patient. That's a huge challenge that healthcare has. Then in terms of the actual uptake, the other side of that coin is this. We take data and so there's a lot of drive within a hospital, for example, to look at efficiencies and to use data for efficiencies, to gather KPIs and measure them. And that certainly is a very important piece to help keep the hospitals operating, to help ensure that we are delivering the best care that we can for our patients, right? Those are key challenges that are also a part of the data analytics environment. And then there's the challenge that goes with that, and that is, okay, now if we feed that on to the doctors, how is that received? Are we now Big Brother? This is something that is slowly changing in mindset, where doctors are starting to become aware of that power of being able to compare their practice with another and then discuss, well, I see that you've got this, how can we achieve that too? And to not just argue the data. And so one of the other challenges you have, and let's just talk about something like a hospital-acquired complication, which do happen, unfortunately, as much as we'd love them not to. What about a hospital-acquired complication? And if one doctor compares his hospital-acquired complication rate versus another, they may look completely different. And then this doctor says, but my patients are elderly, people who will always have a complication. They're a group of people that have that challenge. And your patients are pediatrics. So there's a low complication rate generally with pediatrics. How then are you adjusting me? How are you making sure that you're comparing me with the right level? And then there's debates that go on then about whether you should risk adjust or whether you shouldn't risk adjust, whether you should change the data to fit. So look, those are the challenges I think that are out there for healthcare. And the uptake is slowly growing as they're starting to become really aware of the opportunity that data is providing. And I'm really excited to see the changes that are taking place. In fact, they're taking place very rapidly at the moment.
I feel like what it got me thinking just as we speak is also the economy of scale. I mean, there are number of more of the private hospital or the private healthcare group, but when you are comparing the size of the organization versus the financial organization, literally the size is not comparable. And because of that, perhaps they could never really achieve that economy of skills to be able to adopting and spending like the financial organization. Do you think that?
Well, that is definitely a challenge. And I think we are seeing more and more collaborative exercises between even private hospitals to try and achieve that sort of purchasing power, I guess. But in terms of the data as well, there's the same challenge. Slowly, people are starting to lift, because I think one of the challenges with data is, what are you going to do with my data? Is it safe? Is it being well looked after? Is it secure? And so as particularly Australia, we're quite strict on what we do with our data and how we share it and whether we have permission to share it or not share it as well. And so I think people are starting to become a little bit more aware of the opportunity that sharing their data has. And I think it's just very, very important that we continue to treat it with the care and the even honour that having that data gives us and actually use it effectively. I think that it slowly is lifting, though, that we are actually beginning to share that more effectively. And once more is being shared, we'll be able to see, I think, a lot more. In the research space at the moment, what they do is they'll go out and they'll get the sets of data that they need for their research, but they have to go through major approval processes, and it's generally not connected to anything else. And that's actually a challenge too, because if you're not connecting it to other things, sometimes there's a chance of just looking at it in a silo and forgetting the whole system, which I think in healthcare is quite hard not to do, because where do you stop? Where does the system end?
Now, let's give the listener a little bit more context about why we are talking about healthcare so much. So I want to highlight that you currently work at the Mother Health Services, where you are responsible for ensuring optimal business engagement between the developer of data and digital tools and also the people requesting them, people like the clinician or maybe the service people. If you don't mind, can you please share a little bit more about the organization and also your role at Mother Health Services?
Sure. Yeah, so Mater Health is quite a large healthcare organisation now, and it's broad across the whole of Queensland. And they were started many years ago by the Sisters of Mercy, and their goal was always to provide healthcare in an equitable and easy manner for all people. And I think that they still hold that as their core value. And that's one of the things I love about working for Mater, is just that, their values are people first. And so, yeah, that's, I think, one of the core things. And also it being not-for-profit, it values first, right? There's so much opportunity there, I think, as well, for us to do so much with the data and with the digital tools, and so much need there for that. Yeah, it's a very, very good place to be and to work in that environment.
Wonderful. And your role, your current role, I think you just have a new role, as we spoke earlier, at the Mother Health Services. Do you want to share a little bit more about your new role?
Yeah, sure. It's not overly new now. It's probably been a year or just over a year or so. My role is business engagement, and it's about actually just enabling people to be able to get access easily to the tools. It's about ensuring that we've developed for them as they need. It's about providing them the capability to do that themselves as well. So enabling them to get what they need and even to do the work themselves if they choose. And many of them do choose. That's actually something that they're very excited about and interested in.
Right. Now, you have experience working with data analytics in both in the commercial sector, like, for example, the banking and energy, and also even the non-profit sector. I'm curious to know from your experience, what are the major differences that you found between the commercial sector versus the healthcare, between the two, in terms of that philosophy and the application of the data technology?
Yeah, sure. Look, I think the key difference would be in its drivers. So the drivers are really, as you know, what the key performance indicators are generally aligned with the strategy, right? And the strategy is generally a part of what is driving the organisation. And I think in the key drivers for healthcare, it is a little bit different. You've got economic drivers, of course, and they're relevant to both healthcare and the commercial sector, of course. You're still looking at keeping your costs down. You're still looking at ensuring that, well, actually, it's probably that. It's costs down. Not-for-profit is not about increasing the profit, but it's also about ensuring that there is enough there to help others or to outreach further. And that is something I think Mater does very well. And that's probably a slight difference, where in the commercial sector, you're looking at ensuring that there is enough revenue for shareholders, that the stock prices are up. That's probably one key difference, I think, in the drivers. And in level of exposure, retaining Yeah, I think that's quite similar between both. You still would like to keep the patients coming, but it's a different reason, really. The patients that you want coming, the reason you want to sort of retain them is not, it's not for the reason that you want to keep getting more and more and more, but rather that you want to ensure that they've had the final result, that they're well looked after and that they're able to go back to their previous way of living before they became unwell. So it's about being able to see the patient through the whole journey as opposed to repeat business because we want to get more and more and more. So it's a different reason, right? And I think the risks, so exposure, risk of exposure, etc., you want to keep your risks down, of course you do. But the reason for keeping risks down now is not perception is still important, but it's more about the quality of care for patients. It's about ensuring that they are given a good quality treatment because it's life or death, as opposed to I just want to ensure that I give you a good quality product because I don't want you to tell anybody how bad we are, which is a different thing, right? So I think in the drivers, there are very different drivers, but the other driver that is probably far bigger in certainly in healthcare than I think in any of the other commercial sectors is the social impact. And so like when you're talking about banking and finance, which I think they generally still at the top these days, they're becoming far more thoughtful and considerate about the social aspect. I think that they are starting to do a higher focus on the ethics. But sometimes it's not driven by their desire to do social good as their desire to be perceived as responsible business. Whereas in healthcare, it's actually about, well, how can we stop people from needing to come into hospital? How can we actually have a community outreach that really changes community? How do we just make a difference? Which that to me is, I think, a key difference between the two sectors.
Do you think in terms of the data storytelling, do you think the healthcare is doing enough in terms of this, making sure that it's impact for the data storytelling of like how much they do and what they do and how they are making a social impact in the healthcare services that they provide?
I think that they forget to. That's something I don't think that they do well. I'm beginning to see a little bit more of it in the use of social media, but it seems relatively new to me to see that really being broadcast. And I don't think that they do share well enough the outreach impacts. You know, I don't see much about some of the great work that we're doing in refugee health, for example. I know there's some fabulous work going on there and I'm not seeing it well broadcast. And I would love to see it broadcast more. I think we're doing a lot with Indigenous people and ensuring that there is the right level of care and closing that gap that we've seen historically in their care. And I don't think that that's being broadcast as well as it could be. I think the community outreach work that they do just in general to reduce the need for people to come into hospital is not being well broadcast. The outreach work that they do in the homes, it's not being well broadcast. But there is just so much great stuff that Marta is doing in that way. It's fabulous, actually. That's why I work for them. I very much value their ethos and their approach.
To some extent, I suppose perhaps the needs of the paradigm shifting would be required in the management team to say, there's no shame in broadcasting all the good works that we do in the organization. And not saying that they are ashamed. I think that there is different type of the personality of the people, especially the people who work in this area tends to get their head down, focusing on getting the work done and doing the works, and then forget about sharing and telling a little bit more about what they do. I feel like that is what's missing.
I would agree, yeah. And I don't think that it's just Marta in that respect. I suspect that, and maybe I'm wrong there, so listeners, if any of you are from the US, you can maybe argue with me, but I suspect that the US is doing it a little better than we are. But yeah, I think it's something that we in Australia could be doing better in healthcare too. I think as well, just for an enablement, because it allows people to know that they can go somewhere. Because I think sometimes people just don't know where they should go or how they can get there.
Now, at Marta, you have transformed the analytic and performance team into an analytic hub.
I previously did that. There are others now doing that great work, so I can't claim all of that.
Absolutely.
I certainly can't, but definitely at the beginning I started doing some of that work and enabling more and more people to come into our environment and develop with us. So it was basically a mentoring approach where people would come to us and say, we would like to have such and such a dashboard. And instead of me saying, okay, let me create it for you, I would say, let's help you to create that. And we started to enable them to have that type of mentored approach. We saw quite a number of dashboards and analytics created around that way and that approach. So it's been good, yes. That's a hub type model where you've got the hub and spoke model, yeah.
Right. And on this work that you and this amazing team that is currently doing this work, what are the benefits that you have seen coming up from this transformation? Does it really help spreading the data-driven culture and storytelling?
I think it does. Look, we've got a long way to go before we really see the impact. I feel a little bit sometimes like we're just throwing a pebble back into the sea, and slowly we'll start to see that pile of pebbles decrease. But it is a long process, I think. But certainly we are seeing a difference. And I think that the difference is in the level of engagement. When you create something for somebody, they may or may not use it. When you create something with somebody, they start to really affirm it to others and get others using it too. So there's a lot more buy-in for the tools that are created if they're created by the individuals in the environment than they are if they're created by a data analytics team. Not to say that they shouldn't be done that way, but I think it just has that little bit more buy-in that way.
Right. To some extent, sometimes I think that it's good that to educate and to improve the data literacy of the front line, the team at the front line, because ultimately these are the people who are doing the job day in, day out, who understand all the problems that they are facing intimately, including the challenges that faced by the customer. If they were to understand how data and analytics could improve this process using the hub, the concept of using this analytic hub, perhaps they will be able to get better and understand and come to the analytic team to say, hey, this is the problem that I'm facing or the customer are facing. What can we do about this using data and analytics? Is it something that you would advise other?
Absolutely.
To do that?
Yeah, no, absolutely. I can see the role of data and analytics becoming far more mentor-based and more helping-based as opposed to doing it for-based. And I think our data analytics people need to become more capable with understanding the problem, understanding the processes, and asking the right questions to get those people asking those questions themselves and thinking around change, etc. It's more than just what can I make for you or how can I help you make what you want. It's that whole advice around the whole change piece as well.
That's true. Now, share with us some of other example of how Mother Health Services is transforming with healthcare with data and analytics.
We have got quite a few. Whether I can tell you all of them is another story. There's a lot of opportunities particularly with AI, I guess, and a lot of work being done there around the prediction and being able to predict the flow, and that helps to make sure that we're resourcing appropriately. There's work happening there, which I think is quite exciting. I think just being able to provide the data that helps to make the right decisions in terms of, are we actually doing the right safety? Are we actually working safely? Are we caring for our patients in the right ways around the quality side of things? We've got a lot of work going on there at the moment, and I think it's quite deep work. Yeah, I think that's two, but there's plenty. I'm just having trouble bringing them to mind right at the moment.
Absolutely. What do you think, apart from, I think we sort of like touched on this a little bit earlier, but what do you think are the key challenges of having more data and analytics, especially in terms of convincing the senior management to say, this is the capability that we really have to start to build up in healthcare specifically?
What I'm seeing in healthcare is that leadership are becoming far more aware of the need for data. And they're becoming far more aware of the need for the education of staff. I was in a meeting just the other day where that very question was asked by a very senior person. How are we educating our staff? And I think that's a really fabulous question. And I'm seeing it more and more. So I think that is actually happening. People are starting to become very, very aware that there's a need for data literacy in the organisation. And I'm hearing it in regular podcasts. I'm hearing it also regularly, or seeing it rather regularly in articles that are being written. I'm seeing social media that the focus on data literacy is really increasing. And I think in the last 2 years, it's increased exponentially.
How would you advise others to navigate on this and still successfully bring more analytic capabilities into the healthcare services?
Look, I think a number of things need to be focused on. One is that you actually have the tools to enable people to be able to get what they need. So that's one. The second is that the data is flowing into an environment where people can use it. That's two. And that it is well categorized. And that's actually a tough journey. It's not a short one. So that's the second thing, that there are a good set of indicators or key performance indicators that are defined well, that all people know are there. That's a third one. I think the fourth is to ensure that you have got a good education program created and roll it out regularly. And I think also the fifth one is just to enable your data and analytics workforce to become very business oriented, that they are interacting on a regular basis with the business and that they're not siloed as developers often are. So what I often see is that because to develop, you need to get into a development headspace. Well, this is what I found anyway. And when I'm in a development headspace, I'm actually not in a social headspace. So that's a real challenge, because if you come to me while I'm trying to develop something, I'm not likely to be all that polite because I'm just too busy coding, right? But the fact is that we actually need to have that designated space for that social interaction. And I don't mean necessarily going out for coffees. I mean going and seeing the people. It's useful too. Of course, it has its moments. But I mean going and seeing the people that are using the tools and going, understanding the environment and spending the time talking and getting to know. I think that those things are a very important part of an analyst team's functions. And we shouldn't silo it and just have, I think having a business engagement person is a very powerful function, and I think important, because I become that advocate for that happening. But at the same time, I think it's very important that I don't become that tool and then the others then just do their coding as opposed to them interacting with the business.
I so agree on that. I think it reminded me what I do a lot in the past and what I do still currently is that often I would really talk to the frontline people. And when I say frontline people, I literally mean, for example, if I were working with the insurance company, I would spend time talking to the call center consultant who answer the question or who help the customer with their insurance policy or with their claim. Because not only these people who understand all those problems so intimately, they in fact also understand the data quite intimately. Sometimes they would try to do some tricks to save the time in terms of having to input the data, or they would literally know where the screens are in terms of some of those data in being saved to create the data that we actually use to do all the reporting or do all the analytic model, right? I find that the challenges sometimes is to encourage the developer to say, go and talk to these people. What would you do to encourage the developer to actually go and spend time and sit with these people?
So the only way really to do it, unfortunately, although I'd love to see it just happen naturally and organically, is to actually put structure in to achieve it. So having your design sessions that engage the stakeholders in the questions and ensuring that all the right people are actually engaged, which is harder than you think too. That's probably the best way to achieve that. At least getting that structure in the first place does then enable the ability for them to just pick up a phone and talk to them when they've got a question or, yeah.
And I think I so agree about having a structure, but I suspect that's one of the challenges that arising of having this structure is then really also we need communication between the analytic teams and the front-end team, having the senior manager of the both sides understanding the need and the necessity of the analytic team to wanting to spend this time because...
Oh, for sure, priorities.
Exactly. Yeah. So that it would not be seen as a time wasting or taking up the time of the consultant of servicing the customer or taking up the time of the clinician of helping the patient. That probably the other challenge, I think. What do you think can be done to help that communication?
That's actually a part of the function that I have is to hear what the business need is and to begin to categorize it by a set of categories that we actually have set up for that reason. So I would say that that's one thing, is understand the values and the strategies of both the organisation and also your own environment. So what are the things that are really important to your team to deliver? What are the things that are really important to your organisation to deliver? And if you understand those, then you can have those as your measurement criteria. So we actually have scores on them. And that wasn't the work done by me, but it's certainly work that I do is to help to score the items that come in and to help to sort of give them a point level that means that they can be prioritised. Now, that is actually a bit of a challenge in healthcare, because sometimes something might seem lower in scoring because it doesn't appear to reach efficiency goals or reach financial goals or whatever that might be. But it is maybe reaching the goal of enabling a more data literate workforce. So there's different criteria that you would rate it on, and it's not just on the whether it delivers financially or whether it delivers some of the other goals, but whether or not it actually enables a more data literate workforce is another good scoring reason. That makes sense?
It does. And what it got me thinking also is about the ability to look at the big picture and also the view of the ability to look at the things in the long term. Very often, like you were saying, that some of the things are rated or scored in a lower priority because it doesn't necessarily bring the immediate result, whether it's the efficiency or the financial impact of it. I think challenges here is to how to enable them to look at this thing in a long-term view, so that they understand how actually, by doing it, it will really actually build up the capability and actually take the organization to another level.
Absolutely. Yeah.
Now, this almost brings us to the end of this podcast interview, and I have got 2 questions for you that I always ask my guests. Number 1 is, what is your most important first principle?
People first. I think so. Look, I think in everything that you do, just having the view that will it help? Will it actually make a difference? Will it make a change for people? And will it not hurt somebody? Will it not cause suffering? I think that those are probably very good principles.
I love it. Now, second question for you is, what is one book that you have read and thought it would have been better for your younger self to have?
There's been quite a few that make a big impact. I would say I've read one that I really enjoyed would be Talk Like TED, which was by a guy called, hang on, let me get his name. I'll tell you that one in a minute. But Talk Like TED was fabulous because what he was just doing was getting us to think about the structure and the way that we present things, the way we talk about things, and putting it far more in a story type of approach.
Carmine Gallo.
Carmine Gallo, that's it. Thank you, Carmine Gallo. And another one that is, and actually he also did Storyteller's Secret. I quite enjoyed that one too. But they're very similar. So if you read one, you probably don't need to read the other. The other one, like in terms of data visualization that I've rather enjoyed, is a lady called Cole Nussbaumer, and she's written the book Storytelling with Data. That's also fabulous. In fact, I have one more, and I just try and remember the name of it. If you give me 1 second, I will find it. That one is Data Story by Nancy Duarte. They're very, very good books and ones that I would have liked to have read a lot earlier.
Wonderful.
Yeah.
I probably will double check with you later on if I get them right so that I can list it in the blog and share it with the listener. Now, thank you so much again, Rachel, for coming on to the Analytics Show podcast and share with us a lot of the works that you are exciting and doing at the healthcare services, especially the importance of the data storytelling. I really, really enjoy it. Thank you so much.
That's a pleasure.